This is a video for the recommended sequence for doffing PPE with Papr in the ED. PPE should be doffed in the designated PPE removal area. The following items are needed for proper doffing: a trained observer or PPE monitor, a red bag trash can inside the room and outside of the room, hand hygiene options such as soap and water or hand sanitizer, which is available inside and outside of the room, wipes or spray, one inside, one outside of the room, a clean flat surface outside of the room with a chucks pad, one extra set of clean gloves for Papr wear outside of room. And remember that PPE doffing may occur in the ante room or in an established warm zone outside of a patient care area. We're now going to show you doffing instructions from the trained observer point of view. First, engage the trained observer, or sometimes termed as the PPE monitor. You will also have your Papr wearer inside of the room. The trained observer is going to coach and remind the Papr wearer to avoid reflexive actions that may put them at risk, for example, touching their face or hair. The first part is inspecting the PPE to assess for visible contamination, cuts, or tears before starting to remove. If any PPE is visibly contaminated, then instruct the Papr wearer to clean and disinfect contaminated area using wipes. First, remove gown and outer gloves. Pull gown away from body and roll into itself, peeling off outer gloves at the same time. Perform hand hygiene. Next, the Papr wearer cleans the Papr hood. Wipes all accessible areas of the Papr hood with wipes. Perform hand hygiene. Next, the Papr wearer will exit the room. The trained observer will open the door to the care area while the Papr wearer backs out of care area, enters the warm zone, and then closes the care area door. The trained observer cleans the remaining portions of the Papr. The trained observer wipes down the Papr motor, hose, and remaining posterior portions of Papr hood with wipes. Next, the trained observer will perform hand hygiene. It's okay. Next, we'll remove the Papr motor. The Papr wearer will unclip the belt while the trained observer holds the motor and places on a clean, flat surface. The Papr wearer and the trained observer will perform hand hygiene. Next, we're going to remove the hood. Papr wearer will grab behind their ears, position their body slightly forward, and pull off hood. Carefully place hood next to Papr motor on clean, flat surface. The Papr wearer now removes inner gloves, one at a time. Remember, dirt to dirty and clean to clean. Do not fling, sling, or throw dirty gloves. Perform hand hygiene. The Papr wearer is now ready to exit the warm zone and perform self-care as needed. Next, the trained observer will do a secondary clean of all Papr equipment in the warm zone. The trained observer remains in their PPE and cleans all the Papr equipment with wipes or fusion spray. Note, if using fusion spray, wait 2 minutes to completely dry.
Damn, it is pouring out there.
The train observer will now perform hand hygiene. Next, the train observer will remove the PPE within the warm zone. First, by removing gown and external pair of gloves into red trash can. Perform hand hygiene. Continue by removing mask and face shield. And then dispose of last pair of gloves. Perform hand hygiene and exit the warm zone. This completes our doffing video with Papr use and a train observer.